This is Dr. Mitch Robinson, and this video is on alcohol metabolism, and it accompanies handout number 14 from Cellular and Molecular Medicine. In this video, I'll discuss the metabolic pathway for the metabolism of ethanol and long and short-term metabolic effects of excessive alcohol consumption. We will not be describing the pharmacology or neuropharmacology of alcohol, nor will we talk about how to make a good martini. Ethanol is a small molecule that's both lipid and water soluble, and it can be readily absorbed from the intestine by passive diffusion. About 90% of ingested ethanol is processed by the liver. Now, there are several routes for ethanol metabolism, but the predominant pathway is a two-step conversion to acetate, and this is shown on page 2 of your handout. The first step in the pathway is the conversion of ethanol to acetaldehyde by alcohol dehydrogenase, which we'll refer to as ADH. ADH uses various alcohols, not just ethanol, and it likely evolved as a general-purpose enzyme to remove alcohols. Alcohol dehydrogenase can produce very toxic compounds from alcohols other than ethanol. Methanol is toxic if consumed, and this is because ADH converts methanol to formaldehyde. The next enzyme in the pathway converts acetaldehyde to acetate, and the enzyme is acetaldehyde dehydrogenase, or ALDH. This enzyme also produces reduced NADH. Acetate can then be converted to acetyl-CoA in the mitochondria by acetyl-CoA synthase. So now we have a three-step process for the conversion of ethanol to acetyl-CoA. The first intermediate, acetaldehyde, is fairly toxic. This is the cause of many of the uncomfortable effects observed after drinking excess alcohol. Acetaldehyde is reactive. The aldehyde group can react with proteins, nucleic acids, and other molecules, and the effect can be to damage tissues and DNA. Acetaldehyde is a probable carcinogen, and heavy drinkers are at increased risk of developing cancers of the digestive tract. The rate of alcohol metabolism and clearance and the extent to which acetaldehyde accumulates with alcohol consumption depends on a number of factors, including the activities of the two enzymes, alcohol dehydrogenase and acetaldehyde dehydrogenase. There are several isoforms of these enzymes, and they vary in different populations. The expression of the isoforms also varies with age, sex, and other factors. So the difference in these isoforms and their expression means that people vary considerably in how they metabolize alcohol, and this contributes significantly to differences in drinking behavior. For example, younger women generally have a slower alcohol dehydrogenase enzyme activity, and thus they clear alcohol less efficiently than younger men. So younger women will have a higher blood alcohol level after consuming the same amount of alcohol. Older women, however, often have a higher rate of ADH activity than older men, so they can drink more. ADH activity increases as a result of heavy alcohol consumption, and this is thought to be a major cause of tolerance in alcoholism. In tolerance, there's the need for more alcohol to produce the same effect. Individuals with a slow-acting acetaldehyde dehydrogenase will accumulate acetaldehyde following consumption of even a small amount of alcohol. The result is very uncomfortable effects that include facial flushing, nausea, and rapid heartbeat. There's a variant of acetaldehyde dehydrogenase that's present in about 50% of the people from Taiwanese, Chinese, and Japanese populations that has very low acetaldehyde metabolizing activity. Individuals with this isoform have very uncomfortable side effects of alcohol consumption, and they almost never develop alcohol dependence. Disulfiram is an inhibitor of acetaldehyde dehydrogenase that's sold under the trade name Antabuse or Anabuse. This drug is used to discourage drinking in individuals who have chronic alcohol abuse problems. It causes flushing of the face, headache, nausea, vomiting, and other ill effects whenever an individual consumes alcohol. Disulfiram can cause very serious side effects if patients who take the drug continue to drink. Newer drugs that block the effects of alcohol on the brain are becoming more popular for the treatment of alcohol abuse. There is an alternative pathway for the metabolism of ethanol to acetaldehyde that uses cytochrome P450. This reaction is similar to alcohol dehydrogenase, but it uses NADP rather than NAD. The system is known as the microsomal ethanol oxidizing system, MEOS. Now, this pathway plays a fairly minor role in ethanol metabolism in most people, but in people who drink heavily, the pathway becomes much more active. The pathway produces toxic products, including reactive oxygen species that are damaging to tissues, particularly the liver. So people who drink heavily and metabolize ethanol using the microsomal ethanol oxidizing system experience more damage to the liver and other tissues. Now let's look at the acute and long-term effects of excessive alcohol consumption. Alcohol metabolism results in the production of reduced NADH at two steps, alcohol dehydrogenase and acetaldehyde dehydrogenase. The primary acute effect of alcohol consumption is therefore to alter the reduced and oxidized ratio of NADH. Reduced NADH is elevated, and oxidized NAD is depleted in both the mitochondria and the cytosol in the liver. The effect is inhibition of gluconeogenesis, and this is because malate dehydrogenase tends to convert oxaloacetate back to malate. So the formation of oxaloacetate that's needed for gluconeogenesis is inhibited by the excess NADH. So excess alcohol consumption, especially in people who are malnourished, can lead to hypoglycemia as a result of the inhibition of gluconeogenesis. Also, excessive NADH causes lactate dehydrogenase to convert pyruvate to lactate. The result is that excessive lactate can accumulate and result in lactic acidosis. Another consequence of excessive alcohol production is a defect in energy production due to inhibition of TCA cycle dehydrogenase reactions by the high level of NADH. As I've mentioned, excessive alcohol consumption results in the generation of reactive oxygen species that can damage cell tissues. Also, the accumulation of acetaldehyde, which forms products with proteins and can damage DNA and is a probable carcinogen. An additional long-term consequence of excessive alcohol consumption is fatty liver syndrome, or hepatic steatosis. Again, this is due to an altered ratio of NADH and NAD. Excess NADH inhibits gluconeogenesis. It also inhibits fatty acid oxidation, and it inhibits the activity of the TCA cycle. The acetyl-CoA, that's the product of ethanol metabolism, cannot be used in the TCA cycle and is diverted to de novo fatty acid synthesis. The fatty acids that accumulate are converted to triglycerides. Excess triglycerides in the liver again result in fatty liver syndrome. And that concludes our video on alcohol metabolism.